All right, let's continue. Now we're up to the maxillary specialized forceps, the maxillary right forceps number 88R, and the maxillary left forceps number 88L. Now, all they do is extract trifurcated maxillary right, first or third molars. That means one would approach the left side, one would approach the right side. You don't need to remember this. All you need to know is it's got three prongs, and on the forceps, it would actually write right or left. So if the doctor or you yourself in the future would be needing to know about this, you just read the labeling on the actual forceps. Now we're going to the mandibular forceps. So the mandibular forceps number 17, that's over here, is to extract bifurcated mandibular first or second molars. As you can see, this little hook over here, and there's another hook here. It's designed to grab in between the roots, versus this one is designed to grab between. This one grabs between two roots, and this one grabs the big root that's on the palate. So right over here, this would extract the second and first molars. Then to pull out your front teeth, we would need a mandibular anterior forceps to extract the anterior teeth of your patients. That would be this one. It's usually referred to as the Ash forceps. And then we need a mandibular root forceps to extract mandibular roots if a root is broken. And if we can't take it out with a root tip pick that we covered before in the session, we could use this specialized forceps that has these little beaks that go down to get the roots. Next, we're going to continue to the rongeur. Rongeurs are smaller in size to forceps, so its function resembles that of a fingernail clippers. The rongeur has a spring between the handles, and the blades have sharp cutting edges. The blades of the rongeur may be end cutting or side cutting, depending on the design. The rongeur is used to trim alveolar bone. It is widely used after multiple extractions to eliminate sharp projections, to shape the dentulous ridge. The beaks of the rongeur must be kept clean during the procedure. As necessary, the dentist holds the instrument towards the assistant with the beaks away. The assistant then carefully removes the debris by wrapping the beaks with a sterile gauze sponge. So these are the beaks. This is the area where inside the beaks bone spicules or soft tissue would develop, and then the assistant removes anything that's there with gauze. And it's like taking a knife and removing any food or debris particles with a bounty. Same concept. Now, a bone filer is exactly what it is. There's a straight or criss-cut, so straight and crisscross cuts. Bone filer is used with a push-pull motion. So basically, like you're filing a nail, you're pushing and pulling to smooth the surface of bone after rongeur has removed most of the undesirable bone. Bone files also can be used to smooth rough margins of the alveolus after an extraction. The working ends of bone files are rough and are available in a variety of shapes and sizes.